transmission likely does occur. So what changed yesterday? Yesterday, we had a report from the National Academy of Science, which is a very reputable group. And they cited multiple different studies that now show that the virus can, in fact, be transmitted when it is in a tiny little aerosol. And that's a little bit different than the droplet transmission that we've been talking about, that I think everyone feels comfortable that it could be in a cough and in a sneeze. They cite, data from the New England Journal of Medicine, University of Nebraska, some Chinese, some available data out of Hong Kong as well. And important to note, and I think we have to reiterate this a lot, is that the covering of the face is not protecting yourself. We've said that repeatedly. It's still, the virus will be able to filter through those things, but it's protecting others. So the model of this was, for example, in South Korea, where there was mask wearing pretty much continuously from all sides, and it's basically the public protecting each other, and that's the rationale for it. Should it be done everywhere? It's a covering. It doesn't necessarily need to be a surgical mask, or certainly not an N95 respirator, but literally just a bandana, a cloth. Some studies showed even multiple layers of paper towels could work. So it's something that really feasibly could be done by folks, especially, as Dr. Fauci said, if you're going to a populated place like a grocery store, a pharmacy, those are necessary places folks need to go, that's where people really could be doing this.
Because we don't know so much about this virus, Dr. Azar, I'm curious to get your thoughts, and I know that we're obviously going to be having a lot of these conversations in the weeks and months ahead, but should this have been implemented early on? Should we have erred on the side of caution more as we are seeing other countries go through this, that here we are almost a month into this, 1 million cases worldwide, and we're just starting to get this insight from the CDC to say, hey, let's be a little bit extra cautious. Let's start wearing masks.
Right. So I think, to borrow a term from Dr. Fauci, the retrospectoscope is 2020, right? So anytime you get into a situation where things have either gotten out of hand or there's an explosion of cases, you sit there and you say, my goodness, what did we do right? What did we do wrong? And that, of course, will translate into pandemic preparedness. God forbid we should ever be in that situation again. So look, all I can say is that, again, we have known for a period of weeks and months that asymptomatic transmission can occur. I don't think that we thought that the percentage of transmissible or the number of transmitted cases was that significant. Now we're quoting around the tune of 25 to up to 50% of cases can be transmitted by asymptomatic or pre-symptomatic folks. So, again, I'd like to think that all of our guidance is based in data and science, right. And perhaps there was a lag in that. But I do think now that it's pretty clear that this is happening, and certainly better late than never.
Let me get your personal thoughts here for a moment, if I can. We just heard from healthcare workers here in New York City who say that they are scared for their lives and their families' lives. Can you speak a little bit about your personal experience? How do you feel going into rotation?
Yeah, happy to. So, and just to be clear, again, there's different waves of how folks have been or are going to be reassigned to be working with on the front lines, if you will. The initial wave, of course, is to reassign people who are hospitalists, who are neurosurgical intensivists, surgical intensivists, to help out with the pulmonary and critical care teams. There's fellows who are recently graduated. There's, residents and things like that who have the training to do the pulmonary and critical care. And then there are folks like myself who are in outpatient internal medicine practices with different subspecialties who are being asked to volunteer to work on the medical floors. This may not necessarily and should not necessarily be the most critical patients, because we don't have that kind of training. We do have training, however, to take care of, inpatients who are on the medical wards, which of course the COVID patients are, and they have a lot of comorbidities, heart disease, kidney disease, things like that. That is what we're trained to do. So, as soon as the call for this started a few weeks ago, and as the time progressed and the intensity of the pandemic progressed, those calls became more urgent, to the point now where, most of us are slated to do multiple different rotations or different shifts, if you will. I'm still waiting to get my final assignment. It changes kind of on a day-to-day basis based on the hospital's needs. But, as soon as I got the initial email, my first reaction was 100%. This is why you go into medicine. I felt compelled to volunteer right away, and I'm anxious actually to get in there and help out my colleagues who've been, really doing unbelievable work since day one of this.
Yeah, Dr. Azar, on behalf of a grateful nation, thank you very much for that sentiment, for that attitude, for wanting to help everyone else there. We certainly appreciate it. Wishing you the best to you and all your colleagues. Stay safe, stay healthy. House Speaker Nancy Pelosi creates a special bipartisan committee to oversee the Trump administration's distribution of more than $2 trillion in coronavirus relief funds. Michigan Democrat Dan Kildee joins me next to talk about that. And Caius Kelly may have been the first New York City nurse to die after treating coronavirus patients. Ahead, I'm going to talk to his sister about her brother's legacy and why she's sounding the alarm about the urgent need for protection for medical workers.
Restaurants are facing a crisis, and they're counting on your takeout and delivery orders to make it through. Grubhub. Together, we can help save the restaurants we love.
Told them that if they got me a new chair.
A new kind of investor is changing things up.
I was right. It is.
With an app that's changing the way we do money. Download Robinhood now.
Guys, if you wake up feeling fat, bad back, heartburn, tired, then it's time to get healthy and lose weight with Nutrisystem for Men.
I'm healthier, I'm stronger.
Lose up to 13 pounds and 7 inches overall in your first month. Money back guaranteed. Order now and we'll rush you Nutrisystem for Men.
Not only did I lose 60 pounds, I don't snore.
Act now. Buy 1 month, get 1 free.
Go online or call 888-915-FIT8 right now. Buy 1 month, get 1 free. New Tide Power Pods, one-up the cleaning power of liquid.
Can it one-up spaghetti night?
It sure can.
Really?
Can it one-up breakfast in bed?
Yeah, for sure.
Thanks, boys. What about that?
Yup.
It can?
Yeah, even that.
I would very much like to see that.
Me too.
Introducing New Tide Power Pods. One-up the toughest stains with 50% more cleaning power than liquid detergent. Any further questions?
Nope.
One-up the power of liquid with New Tide Power Pods.
Grab hold of a legendary DR field and brush mower and put it to the test on your property. Get a DR field and brush mower and get the job done right. For your free buyer's guide, call 1-800-440-9147. Free shipping is now in effect. Your satisfaction is guaranteed. Online at drfieldbrush.com.
Introducing Tonal, an entire gym and personal trainer that fits beautifully into your home. Tonal combines expert coaching with 200 pounds of digital weight. Whether you're looking to build strength or get lean, there's a coach and program to help you get there. And just like a personal trainer, Tonal dynamically adjusts the weight for each exercise. But the most amazing thing isn't what it can do, but what it knows you can do. Learn more at Tonal.com. For every staircase supporting a grand entrance, door frames marking milestones, floors kissed by bare feet, and walls making room for new memories. Protect the pure joy of home with Terminix. We're committed to keeping termites out of your home with our all-new On-Guard termite protection system. Always backed by the Terminix promise to keep your home strong enough for all the love it holds.
These are uncertain times. Challenging times. We all have questions, concerns, and a need for information. Information that can make ourselves, our families, and our communities safer, and put us all a little more at ease. There's still a lot we don't know, but we're not going to stop until we get answers, right to you, right as it's happening.
At think right now we need a fourth bipartisan bill. And I think the bill could be very much like the bill we just passed. Let's update it for some other things that we need. And again, put money in the pockets of the American people. Another direct payment. Extending. We had unemployment at 6 months in our bill. It's 4. Let's take it to 6 for the unemployment.
All right, so that was House Speaker Nancy Pelosi on CNBC within the last hour, pushing for another stimulus bill after today's bleak unemployment report. Her call comes a day after she formed a select committee that will have subpoena powers as it oversees the administration's coronavirus response. It is already setting up a clash with President Trump.
It's not any time for witch hunts. It's time to get this enemy defeated. Conducting these partisan investigations in the middle of a pandemic is a really big waste of vital resources, time, attention.
I'm joined now by Congressman Dan Kildee, Democrat from Michigan, who serves in the House leadership as Chief Deputy Whip. Congressman, thank you very much, sir, for taking the time to join us this morning. Let me begin with your reaction to what the president just said about this committee, which, as he described it, will lead to a witch hunt. Are you concerned this may become or turn partisan?
It should not be. I mean, we are spending $2 trillion. We ought to have some oversight on this. We go back to World War II. The Truman Committee was set up to make sure that as they were spending what was then hundreds and hundreds of millions of dollars on the war effort, that there was some oversight. The president just doesn't get to take this big pile of cash and spend it in any way he likes without any scrutiny. Congress appropriated this money. We have a responsibility to oversee the implementation of these dollars. That's our job. That's what the Constitution requires us to do. And every time the president sees something that he doesn't like, he uses the term witch hunt or hoax or some other pejorative. This is the way our government works. This is the Constitution.
We learned last night, Congressman, from the coronavirus task force that the administration is delivering PPE, personal protective equipment, that it is acquiring to medical supply companies instead of delivering them to the hospitals who need them directly. Does that make sense to you? I mean, is that something that the new committee, the new House committee, should look into?
Well, I think we need to look at all aspects of the response to this pandemic, particularly the use of the dollars. But there have been a lot of questions about the way the administration has handled the distribution of PPE. The president considers himself a wartime president. This is no way to conduct a war. You don't conduct a war through the marketplace, and you don't conduct a war by saying each of the 50 states needs to come up with their own strategy for the war. That's not how we do things. The president needs to centralize authority over the management of PPE. He needs to empower somebody with the ability to manage logistics over the PPE and its distribution, and not treat everything as if it's a profit-making enterprise, or treat everything as if he doesn't want to take responsibility. It seems as though the president's willing to do anything for which he has to accept no responsibility. And anytime it comes to scrutiny, he wants to either pass it off to the marketplace or pass it off to governors. We need a leader.
Congressman, I'd like to switch gears for a moment. I want to get your reaction to the news about the Navy stripping the captain of his command of the Theodore Roosevelt aircraft carrier after he sounded the alarm about an onboard coronavirus outbreak. The acting Navy Secretary, Thomas Modly, says, quote, Captain Crozier allowed the complexity of the challenge of the COVID outbreak on the ship to overwhelm his ability to act professionally. Do you accept that explanation?
Well, I think we're going to have to know more about this. I think anytime somebody speaks up in order to protect the people under their command, they're probably doing the right thing. And if he felt, and I don't know all the details, so I don't want to get ahead of myself, but if he felt as though the safety of the people under his command was somehow being compromised, not only does he have a right, but he has a duty to speak up on their behalf. But again, I'll need to know more detail about this. But this is, I think, another example, if it is the case, that the president's administration seems more willing to stifle critics rather than to actually listen to the criticism that they might be offering as a potential way to do a better job.
Let me, sir, ask you really quickly about your home state of Michigan. There's been a spike in coronavirus cases there with more than 10,000 cases now. Detroit, they're transforming the TCF Convention Center, I'm sure as you're aware, into a temporary hospital to treat some of those coronavirus patients. Are you confident that your state has the resources it needs today?
Well, we need more resources. We certainly need more of that vital PPE capacity. We need, for our healthcare workers and other first responders, more of that. But this is overwhelming, the facilities that we have. In parts of the state, we haven't gotten to that point yet, but we know we will. So while Mayor Duggan and Governor Whitmer are working very well together to try to stand up what they can in Detroit, we're looking at other facilities outstate to try to determine what can be quickly retrofitted to deal with what is really going to be an onslaught of cases. This is overwhelming us all, and I think it does speak to the fact that we need a more coordinated effort at the federal level, and that's something that I think the governor's been asking for. The president tried to punish the state of Michigan because of the governor's insistence on that. But I think it's a problem that every state that is having the kind of numbers that we are seeing are going to be wrestling with, and it's a very big challenge.
All right, Michigan Congressman Dan Kildee, sir, thank you very much. Stay healthy.
Thank you very much.
Thank you. Up next, we're going to hear from a nurse and a doctor on the front lines of this crisis, one who warns the importance of keeping medical workers virus-free, and the other who says treating COVID patients is taking an emotional toll on his medical staff. But first, a quick update on a story we brought you yesterday on the 2020 Democratic race in Wisconsin. A federal judge in that state says there is nothing he can do about the state's primary election, which is still scheduled for this coming Tuesday, believe it or not. The judge denied Democrats' request for a delay and blasted state officials for not postponing that primary. But he managed to ease absentee voting rules so people who live alone can now vote without a witness present.
We have looked to our federal government for strength, guidance, and leadership in a national crisis, and we have found it lacking. But look everywhere else, and that strength, that leadership, that comfort and support and innovation and expertise, it's there in spades. America's best is coming out as America faces its worst. The world is standing strong. America is standing strong. And America, I salute you, because this is who we are, and we're all in this together.
$9.95 at my age?
$9.95. No way.
$9.95? That's impossible.
Hi, I'm Jonathan, a manager here at Colonial Penn Life Insurance Company, to tell you it is possible. If you're age 50 to 85, you can get life insurance with options starting at just $9.95 a month.
Okay, Jonathan, I'm listening. Tell me more.
Just $9.95 a month for Colonial Penn's #1 most popular whole life insurance plan. There are no health questions to answer, and there are no medical exams to take. Your acceptance is guaranteed.
Guaranteed acceptance? I like guarantees. Keep going.
And with this plan, your rate is locked in for your lifetime, so it will never go up.
Sounds good to me. But at my age, I need the security of knowing it won't get canceled as I get older.
This is lifetime coverage as long as you pay your premiums. It can never be canceled. Call now for free information. You'll also get this free beneficiary planner. Use this valuable guide to record your important information and give helpful direction about your final wishes to your loved ones. And it's yours free. It's our way of saying thank you, just for calling. So call now.
Call 1-800-247-5790 now for your free information and your free gift. That number again is 1-800-247-5790. Call now.
Attention! Do you have Medicare? Did you know that you may qualify to get $135 added back to your Social Security check every month? It's easy to see if you're eligible. Just call the Go Medicare Benefits Help Center at 800-739-1546. In addition to receiving $135 every month, you might also qualify for a $0 Medicare Advantage plan that includes the following benefits: dental, including fillings, exams, and dentures; vision, including exams, frames, lenses, and even contacts; hearing, including hearing aids and batteries; and prescription drug coverage, all at no additional cost. The Go Medicare Benefits Help Center is open now at 800-739-1546. Both the call and the consultation are 100% free with absolutely no obligation to enroll. Call the Go Medicare Benefits Help Center now at 800-739-1546. That's 800-739-1546.
It's time we remind the world that women over 50 still exist. Intimates for every age at Nix.com.
Hi, I'm Hanno. I created Gabi because most people overpay on car insurance. Gabi is a free tool that saves you money by finding the best deal. Gabi users save more than $800 per year on average. Go to Gabi.com and stop overpaying for car insurance.
A moving show of solidarity on the front lines of the coronavirus crisis right here in New York City. Firefighters applauding doctors and nurses who are in the epicenter of the pandemic. I'm joined by two healthcare workers on the front lines of this crisis. Rick Lucas is a registered nurse at Ohio State Wexner Medical Center and is president of the Ohio State University Nurses Association. And I'm joined by Dr. Dennis Lemansky, senior vice president at Henry Ford Hospital, who's in charge of the hospital's doctors. He also practices family medicine. Rick, let me begin with you, if I may. You've shared some pictures with us about what it's been like to be on the front lines of this crisis. Talk to us a little bit about you and how your fellow healthcare workers are coping, and what kind of hours are you being pushed to work right now?
So right now we're really prepping for the surge to come in the next few weeks. The pictures that are being shared there are there's collection bins where we're collecting N95 masks to be reprocessed. So that's giving a lot of hope to our healthcare workers that they're going to have the equipment that they need. We're also seeing some changes on the front lines that nurses and everyone on the front line are going to wear masks and goggles to help protect themselves from contracting COVID here at the hospital.
Hey, Dr. Lemansky, I'm curious to get your thoughts in Detroit. As we mentioned earlier with the congressman, the TCF Convention Center is being converted into a temporary hospital. Talk to us a little bit about what you're seeing at your hospital. And is it at this stage, because there is this kind of discussion taking place in the country, certainly online, whether or not some hospitals are more overwhelmed with patients at this stage or not yet?
Well, at the present time, within the Henry Ford Health System and Henry Ford Wyandotte, we're getting very close to our limit. However, we continue to think out of the box on how within our own four walls at each unit in the health system, how can we create greater capacity. It's been an unbelievable effort by everyone involved on the healthcare delivery team.
Rick, I know that healthcare workers around the country have been sounding the alarm about a shortage of PPE. We played a soundbite earlier of some nurses here outside of Mount Sinai Hospital in New York City. Do you guys have what you need at this stage, or are you also facing a shortage of supplies? Rick? Rick, I'm not sure if you can hear me. I was asking if you guys have the supplies that you need.
So right now, we do believe there's a shortage. It's disturbing to see the falling standards, keeping frontline healthcare workers safe. You can't really talk about PPE without thinking about it in terms of patient safety and not spreading COVID-19 from healthcare workers to patients. So right now we're negotiating with the hospital to make N95 the standard for all nurses and frontline healthcare workers caring for patients that are positive for COVID-19 or rollouts.
Dr. Lemansky, I've learned, we've all certainly learned, and we've gotten to know the name of hydroxychloroquine, but we've learned that about 800 patients hospitalized with the coronavirus in the Henry Ford Health System have been treated with the anti-malaria drug hydroxychloroquine. Can you give us a little bit of insight into how effective that has been? Is it actually working?
I'm sorry, I'm really do not have those numbers with me. I know that that trial has been ongoing. Also, yesterday we announced a clinical trial that was going to be used for frontline employees to begin treating them with the medication in hopes that it might prevent them from becoming infected. But to answer your first question, I'm sorry I don't have that data readily available to me.
No, certainly. Certainly I understand. It's just one of those issues that I think a lot of people are hearing the name and want to know if there's anything. People are, I guess, in a sense of desperation, looking for any glimmer of hope. Dr. Lemansky, let me ask you really quickly, more on an emotional front here. We've been seeing some moving pictures of people displaying white ribbons in a show of support for healthcare workers. Talk to us a little bit about what goes through your mind when you see that solidarity and you see the community in places like Detroit coming together like this.
Well, it touches your heart. When we thought about this campaign, it reminded me of back in World War II, when I believe in windows of homes where their family members were serving our country, there was a star in the window. And I think we remember during the hostage crisis when there were yellow ribbons tied around trees. So we felt that if we could show to our healthcare providers that we support them, we appreciate what they're doing. That started last week. But now everyone's involved in this. Whether you are directly involved in healthcare at the bedside, you work in the hospital, not at the bedside. But today we had, because our governor announced that the school year is closed, many of the school districts are now bringing some of their supplies to us. We've had companies, both small and big, bring their supplies. I think the white ribbon now means more than just healthcare. We are all in this, and I think that it shows that we're all working on this and supporting each other. It's very important.
Yeah, we certainly are. This is beyond just frontline workers. It is the entire country is experiencing.
Yes.
Dr. Dennis Lemansky, Rick Lucas at Ohio State, thank you very much to both of you. This week on our new podcast, Into America, host Tremaine Lee speaks with a first-time expecting mom about how the coronavirus outbreak is changing her birth plan. Plus, MSNBC contributor Eric Deggans talks about the death of his mother and having to coordinate a funeral that many could only attend online. Listen and subscribe for free wherever you get your podcasts. Up next, 48-year-old New York City nurse Caius Kelly died last week after treating coronavirus patients. In a Facebook tribute, his sister said Kelly ran toward the oncoming enemy, determined to bring survivors back with him. That's who he was. She joins me next, right after this.
Flawless, the easy way to remove facial hair. Instant, painless. With an 18-karat gold-plated head, it's gentle and safe to the touch. Flawless removes hair instantly and painlessly with micro-precision. A built-in light makes it easy to see and remove every single hair from your upper lip, cheek, or chin. No nicks, burns, or irritation. You are flawless. Now available at these fine stores.
Now's the time to make good nasal hygiene your new normal. Navage uses powered suction to wash, rinse, and moisturize the nose naturally for drug-free sinus relief. Navage cleans your nose by flushing out allergens, mucus, and germs.
I used to get so congested, but Navage cleans out all the stuff that makes me miserable so I can breathe again. And it's so easy, anyone can do it.
Online and at these fine stores. Over 1 million sold. Navage. Clean nose, healthy life.
When I get my teeth cleaned, my hygienist doesn't use something like this. She cleans with something like this. It's got a round head and it's got power.
Go pro with Oral-B. Power one on for Oral-B's best clean ever. Inspired by dentists, Oral-B's round brush head surrounds each tooth to remove more plaque along the gum line for cleaner teeth and healthier gums.
I'll only use the one that's round.
Oral-B. Brush like a pro.
Everyone loves the benefits of compression socks, but they're just so hard to get on. Until now.
Introducing the all-new Copperfit Energy Socks, redesigned for the first ever easy on, easy off fit to help reduce swelling, relieve tired, achy muscles, and provide energizing support. A new blend of stretch fabric for the most comfortable, easy on, easy off compression fit.
Being a SWAT commander, we train to win. The Copperfit Energy Socks, they didn't feel like other compression socks. They totally exceeded my expectations.
Our most powerful copper-infused fabric, woven into our easy-on, easy-off compression sock to help reduce swelling discomfort from prolonged sitting or standing.
I'm 38 and a half weeks pregnant. Copperfit Energy Socks worked beautifully.
Extra support around the arch and ankles for increased support and relief of muscle aches and pains.
I'm so excited about these socks. I'm so much more energized to go do things after a day of work. They just slip right on, yet they still have that same compression that you want.
A soft cushion footbed for all-day comfort.
I'm on my feet at least 9 to 10 hours a day. These were fantastic. A lot of compression socks are a little too thin, especially for what I do. With Copperfit, I can wear these every day.
Feel more energized. Feel more active. Just feel better.
They just hug your leg. It relieves all the pressure that you have. I have so much energy, I can go, hey, you want to dance?
The first ever easy on, easy off compression sock. The most comfortable compression sock you will ever wear. Get your Copperfit Energy Socks now online at GetEnergySocks.com for only $19.99. Call 1-800-290-8143. Order right now and we'll include a second pair of compression socks free.
I've never felt anything like it before.
No more pain, no more swelling, no more achy, tired feet. I can never go back to regular compression socks again.
Don't settle for ordinary. Ask for the original by name, Copperfit Energy Socks.
Right now, every minute of every hour of every day, medical workers are putting their lives on the line to save coronavirus patients across the country. The numbers of medical workers becoming sick already reaching alarming heights. Testing data falls short, but in Ohio, as of Wednesday, medical workers accounted for 18% of the state's confirmed cases. These heroes are more than just numbers, and we want to tell you more about one of them. We reported last week on the tragic death of Caius Kelly, an assistant nurse manager at Manhattan's Mount Sinai West Hospital. His sister, Mariah Sharon, joins me now. Mariah, thank you so much for speaking to us. I can't even imagine what you and your family are going through in this difficult time. How are you guys coping? How's everyone doing?
Thank you for having me, and thank you for asking. My parents are having a particularly difficult time. I think part of their struggle is even at this moment, we still don't have him home. They don't have him home in Michigan. As for me, it's day by day. I'm energized and determined to continue to fight for our healthcare workers and those on the front line, that we finish right. We did not start, and we are not handling this well right now. So I'm kind of in a zone,
right.
And
I want to get to that in just a moment, but can I just pick up on something you said? You said he has not been returned home to Michigan yet. Can you walk us through a little bit just the final moments, the final days? Why has he not been returned to Michigan? Have you been able to hold a funeral for him, given how difficult of a time this is?
I don't know why. We were a little perplexed on the challenges, but he was supposed to be home yesterday. And I want to say that I do think that efforts are being made. Governor Cuomo actually called my parents and said that he would do everything he could and would get him home. Yesterday, he was supposed to be on a flight home, and my parents received a call that whomever was taking him to this particular flight missed the flight, but they were also told that it was the last flight out of New York that would carry a coronavirus person. So at this time, my parents have sent a car to go to New York and get him. So we are just going to take care of it ourselves.
Yeah, it's just completely heartbreaking to hear that story. We certainly wish that your family gets the closure that it deserves in all of this. Let me just ask you, if I can, about your brother here for a moment. Tell us a little bit about how much he told you how sick he was in those final days. I mean, if you can share with us how he came to learn of his diagnosis and how he shared that with you and the family.
Eamon, thank you for that question. We still have holes in the story, and we don't have a full timeline yet. My mother has requested medical records, and we think that basic things like when he checked in, compared to how many days it was after his test was positive, to when did he go immediately to the ICU or not. We don't have those pieces, and we can't get answers. So we're going to review the medical records and fill that in. But for me personally, he texted me on the 18th of March and shared with me that he was in the ICU, that he was sick, that he would be okay. And part of this text, he asked me not to tell our parents. Now, our parents knew that he had a positive test. I did not up until this text message, but he had told them a few days later, but he really downplayed it. He never wanted to worry our parents. They're older and have health issues, and so protective of them. But he shared that he had a positive test within that text, that he was on a vent. He said he explained that he couldn't call. He said, I can't talk.
Right.
I choked and so forth. And then he said he was going to go back to sleep, and sent me the heart emoji on his back. And that was the last that I would hear of my brother.
Let me ask you about his legacy in the middle of all of this, because I'm sure that you are hearing from a lot of frontline workers. What do you want your brother's legacy, his sacrifice, his life to mean, not just for medical workers, but for this country and for those fighting on the front lines?
It's a great question. I don't think I have to want his legacy to mean anything, because it means what it means. His legacy is living and breathing, and the kind of person that he was, just the beautiful heart that he was. His face will be known as the first healthcare provider in New York, but his legacy was his servant leadership. That's his legacy. His legacy is that he served his patients and protected his unit the best that he could, and that is known. That it is known by those that know him and those that have worked with him. But also just the beautiful heart and spirit that he was. He was just an amazing man in every way.
Yeah, and as I said in the top of the segment, we don't want to just focus on the numbers. We wanted to tell this story, so we certainly hope that this story is heard all across the country. Mariah, Sharon, thank you so much for sharing this. We hope that your family gets the closure that it deserves. Please come back and share with us anytime.
Three things. May I? Three things.
Go ahead, Mariah.
We need Congress to step up and pass some kind of protective act for our healthcare workers. As you reported earlier, they're being threatened with their jobs termination if they speak. The PPE that they're being provided is disposable daily PPE. It is not sufficient for what they're dealing with, and we desperately need someone to step in. We need leadership to take charge of this and truly protect them. This is so complicated, and there's so many layers, but we can save lives if we do the right thing.
And certainly, hopefully somebody will listen to you and answer that call. Mariah, Sharon, thank you so much again, and our best to you and your family, excuse me. You guys are all in our thoughts and prayers. New York Governor Andrew Cuomo expected to update reporters on the coronavirus efforts here in New York State. That is going to take place at the top of the hour. We'll certainly bring that to you live when it gets underway. But up next, states like Texas and Florida allowing churches to continue to stay open and hold sermons despite the pandemic. We're going to hear from an author who says it is crippling the nation's coronavirus response.
Saturdays happen. Pain happens. Aleve it. Aleve is proven stronger and longer on pain than Tylenol. When pain happens, Aleve it. All day strong.
Use Ibotta every time you shop. You'll earn real cash back on every purchase at over 500,000 stores. Simply pick your offers and go shopping. Then take a picture of your receipts. Download now and get your $20 bonus just for trying the app.
And Doug.
Give me your hand! I can save you! Lots of money with Liberty Mutual! We customize your car insurance so you only pay for what you need!
Only pay for what you need.
Liberty, 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 liberty.
Restaurants are facing a crisis, and they're counting on your takeout and delivery orders to make it through. Grubhub. Together, we can help save the restaurants we love.
Introducing Tonal, an entire gym and personal trainer that fits beautifully into your home. Tonal combines expert coaching with 200 pounds of digital weight. Whether you're looking to build strength or get lean, there's a coach and program to help you get there. And just like a personal trainer, Tonal dynamically adjusts the weight for each exercise. But the most amazing thing isn't what it can do, but what it knows you can do. Learn more at Tonal.com.
We're K-12, and we're giving families an online option for public education, where schools provide students with the personalized attention they deserve. Students can thrive, find their passion, and learn in an environment that encourages discovery. K-12 is an online public school option that's tuition-free. Visit K12.com to learn more. K-12, education for anyone.
I did hearing aids from another company. I was just frustrated. I almost gave up. With Miracle Ear, it's all about service. They're personable, they're friendly. I'm very happy with them.
We provide you with a free lifetime of aftercare, meaning free checkups, cleanings, and adjustments.
I see someone new, someone happy. It's really made a difference.
Call 1-800-MIRACLE to start your 30-day risk-free trial and schedule your free hearing evaluation at your locally owned Miracle Ear today. We're Oscar Mayer Deli Fresh, and you may know us from your very first sandwich. Your mammoth masterpiece, and whatever this was. Oscar Mayer has founded more fridges than anyone else because it's the taste you count on. Make every sandwich count.
Growing alarms about some churches defying warnings against large gatherings, multiple clusters of coronavirus cases being traced back to churches across the U.S., some later moving meetings and services online. Others rejecting protective measures and putting congregations at risk. Compounding the issue, religious carve-outs in many statewide stay-at-home orders, including in Florida and Texas. A review by CNBC finding of the 15 states in the nation home to the highest percentage of especially at-risk individuals, at least 11 were not barring religious gatherings as of Thursday morning. Joining me now is Catherine Stewart, author of The Power Worshippers, Inside the Dangerous Rise of Religious Nationalism. She's also a New York Times contributor. Catherine, thank you so much for joining us. We should be clear that those state religious exemptions are not limited to a specific religious group. In fact, you're arguing there's more to the responses that we're seeing, which is religious nationalism. You have a New York Times op-ed titled, "The Religious Right's Hostility to Science is Crippling Our Coronavirus Response." Walk us through your thinking a little bit. What do you mean by that?
Well, that's true. My concern here is not with any particular religious creed, but with the political movement that often cloaks itself in religious rhetoric. So there are a number of ways in which the religious right bears some responsibility for the current incompetence in our national response. First and foremost, the movement promotes an anti-science culture that rejects the evidence of science, rejects expertise and critical thinking, and that has obviously contributed to our ability to address this issue and this crisis in an evidence-based fashion. Misinformation is rife in these sort of hyper-conservative and also highly politicized religious communities that we're all in for Trump. Secondly, and this is becoming, unfortunately, incredibly obvious right now, we have a poorly developed collective infrastructure, the kind of infrastructure you need to craft a collective response to a collective crisis. And that is a consequence of far right-wing economic policy, government bashing, and religious nationalism. There's some implication, is implicated in that too. The movement has allied itself completely with a kind of libertarian a far-right economic wing of the Republican Party, and so it shares some of the blame that falls on that group. Religious nationalists have also supported politicians and policies that have led to the privatization of healthcare and the hollowing out of the social safety net. So that's...
Let me ask you really quickly, and let me just ask you really quickly, from what I've seen a little bit about this, there are some churches who are holding online services, who are trying to encourage their followers to abide by these stay-at-home orders. What have you, from what you've read or seen or studied, have you seen a difference as to why some churches are and some churches aren't? I mean, I'm curious to get your thoughts why some have closed their doors and encourage people to go online, and others are saying we're going to defy these orders and still have these congregations.
Well, religion is incredibly complex. As you know, American Christianity, evangelicalism is an incredibly complex movement, religious group in our country. And so there's going to be a variation in the responses, of course. But there is a kind of segment of the religious right that has taken a kind of all spin, all politics, sort of hyper-partisanized view of the world. And they've often actually rejected the evidence of science, as you know, and also spun everything for political gain. And so this idea that we need to sort of stay home to flatten the curve is often cast as a kind of an attack on Trump, an attack on their faith. And that's why I think many of the movement leaders greeted the news of the virus as an insult to Trump, which was kind of astonishing. As late as March 13th, Jerry Falwell Jr. went on Fox and Friends to call the response to coronavirus hype and overreaction, and he said it was an attack on Trump.
Right. We certainly hope that leaders of any faith heed the warnings coming out of health officials, as this is a public health pandemic. Catherine Stewart, thank you very much for your time. I appreciate you taking the time to speak to us today. Thanks for watching this hour of MSNBC Live. I'm Ayman Mohideen. After a quick break, more news with my colleague Craig Melvin and his interview with the new head of the bipartisan committee overseeing the coronavirus relief funds, Congressman Jim Clyburn.
I've always loved Henry's independent spirit. But since his onset of dementia, it became apparent we needed help. We weren't going to trust just any online service. That's why we selected our caregiver from Visiting Angels.
Our caregivers offer compassionate, specialized dementia care. With over 20 years' experience, Visiting Angels is the obvious choice for your peace of mind.
Visiting Angels, America's choice in senior home care.
$9.95 at my age?
$9.95. No way.
$9.95? That's impossible.
Hi, I'm Jonathan, a manager here at Colonial Penn Life Insurance Company, to tell you it is possible. If you're age 50 to 85, you can get life insurance with options starting at just $9.95 a month.
Okay, Jonathan, I'm listening. Tell me more.
Just $9.95 a month for Colonial Penn's #1 most popular whole life insurance plan. There are no health questions to answer, and there are no medical exams to take. Your acceptance is guaranteed. Guaranteed acceptance? I like guarantees. Keep going. And with this plan, your rate is locked in for your lifetime, so it will never go up.
Sounds good to me. But at my age, I need the security of knowing it won't get canceled as I get older.
This is lifetime coverage as long as you pay your premiums. It can never be canceled. Call now for free information. You'll also get this free beneficiary planner. Use this valuable guide to record your important information and give helpful direction about your final wishes to your loved ones. And it's yours free. It's our way of saying thank you, just for calling. So call now.
Call 1-800-247-5790 now for your free information and your free gift. That number again is 1-800-247-5790. Call now.
My mom is 81, and I worry about her. So I went online and found the new Lively Mobile Plus from Great Call. If she ever needs help, she can just press the button. And with the Great Call Link app, I'll get an alert right on my smartphone if she does contact 5-Star.
With the fastest call response time, they'll assess your situation, confirm your location, and send you the help you need.
Available at Walgreens or online at Best Buy or Amazon.com. AARP members get an exclusive discount on select plans.
This is an unprecedented savings announcement from Kane's Furniture. Right now, get 20% off your entire purchase with no minimum purchase or no interest for 60 months, both with free delivery. 20% off everything store-wide, from family rooms to home offices. There's plenty of room to shop in our 65,000 square foot showrooms. Or shop online and get it delivered free. Unprecedented savings right now at Kane's Furniture.
I have a new catchphrase.
Suit up.
Cool. Welcome aboard.
That could be a catchphrase.
Oh, I love you.
Oh my God!
Blur.
Have mercy!
Like my shiny metal. Whoa!
And a good Friday morning to you, Craig Melvin here. We have reached a new milestone in this crisis. More than 1 million known coronavirus cases worldwide. Any minute now, New York Governor Andrew Cuomo will be holding that daily press briefing about the escalating situation in his state. He now says that the Javits Center, that convention center, that massive convention center originally intended for non-COVID patients, will now be treating people who have the virus. The governor also warning that at the current burn rate, New York will be using every ventilator it has in just 6 days' time. We're also continuing to track the surge in cases across the country. Right now, there are more than 246,000 known cases in the United States. That's more than 29,000 cases than this time yesterday. So far, the virus has killed nearly 6,000 Americans. Let's go right to NBC's Ron Allen. Ron is at Mount Sinai Hospital in New York City, where medical professionals there are still begging for more supplies. Ron, what are you hearing from those workers there at Mount Sinai?
A lot of emotion, Craig, a lot of frustration, a lot of anger, a lot of fear, too, about working in conditions that one described as walking into a suicide mission just about every day. We've heard so many stories of healthcare workers getting ill, passing away as they've been trying to save lives. Of course, the deluge of patients is just getting bigger and bigger, and the fear here in New York, as you know, is that next week could be even worse as we approach the peak, the apex that the governor and others keep talking about. Here and across the city, they are just burning through personal protective equipment, masks, gowns. The more that come, the more get used. It just seems like there's no way to meet the demand. Here's some of what the professionals were saying this morning about how they see the conditions here.
This is life or death. Every hospital in the state of New York and across the United States should have the supplies they need. We are afraid for our patients. We're afraid for our families. We're afraid for our lives. They all failed to protect us as healthcare workers, as citizens. They're putting all of us at risk every single day.
We just got a statement from Mount Sinai, one of the largest hospital system in the city, very concerned about this, obviously, and saying essentially that we understand the fear, the concerns, and we will continue to do everything possible to protect our heroes on the front lines. We will not stop until this crisis is over. They say they're moving heaven and earth to try and get supplies, not just from the city and the state, but they're also, like this hospital and others, are looking for private donations. Some are coming, of course. We heard about the donation by the New England Patriots and others that's arriving today. But again, Craig, it just seems that millions and millions of masks are coming and other supplies are coming, but it just seems like it's impossible to meet the need here. And
Ron, I hate to cut you off.
You know, they talk about
I hate to cut you off. Governor Andrew Cuomo now holding that daily briefing. He will likely address this. Let's listen in.
Which is actually more appropriate today than when we started this process. E pluribus unum, out of many one. Out of many one. It was our founding fathers' fundamental belief for this nation. Adams spoke to it, Madison spoke to it, Jefferson spoke to it. Although they had a lot of different opinions while they were doing the Constitution, the one thing they agreed with was E pluribus unum, out of many one. And it was good advice then, it's even better advice today. The curve continues to go up. The number of tests has reached a new high. We did over 21,000 tests. Thank you to our great health department. We have over 10,000 new cases, 102,000 total tested positive, 14,000 hospitalized, 3,700 ICU patients, 8,800 patients discharged. That's good news. Number of deaths, highest single increase in the number of deaths since we started, 2,300 to 2,900 deaths. You see the totality for New York State, 102,000. New Jersey, California. Remember when this started, New York had airports that were designated entry zones. This is an international destination, international hub. We have people coming from across the world sooner and at a higher rate than anyone else. Total hospitalization, 1,400. That's also a new high. Daily ICU admissions is down a little bit, but you had more deaths, you have more people coming into hospitals than any other night. Also more people going out, which is obviously the ebb and the flow that's coming in and out of the hospital system. The hot spots, we now track on a nightly basis how many people go into what facility, so we can track the increase in what's happening. You see an increase in New York City, as we knew. Certain communities, frankly, more in New York City than other communities. But you also see an increase on Long Island, which is something we're concerned about. Long Island does not have as elaborate a healthcare system as New York City. We don't have the same amount of resources on Long Island, and we see an increase in the number of cases on Long Island, and that has us very concerned. Supplies, PPE, are in short supply, as they are across the country. We need companies to make the materials. It is unbelievable to me that in New York State, in the United States of America, we can't make these materials, and that we are all shopping China to try to get these materials, and we're all competing against each other. These are not complex materials. And we will work with New York manufacturers. We'll finance the transition necessary to make these materials. I mean, we talk about them as if they're very complicated. This is an N95 mask. This is it. It was 70 cents before this started. It's now as high as $7. But this is all that an N95 mask is. It's fabric, it's material. The FDA has the specifications, and then it's 2 pieces of elastic cord. It can't be that we can't make these. This is a gown. We call them gowns. This is a gown. There's nothing sophisticated about the manufacturing of this garment. Not to degrade the garment. There's nothing sophisticated about the material. It can't be that companies in this country and in this state can't transition to make those supplies quickly. Again, I understand if there's a financial burden, we will address that and we will work with you. So please contact us. Javits is going to be converted to a COVID facility. The original plan was to use Javits. Javits is a state convention center. It was retrofitted by the Army Corps of Engineers to hold 2,500 people. The original plan was that it would not take COVID patients, COVID positive patients. It would take non-COVID patients, and it would be an overflow for hospitals. As it turned out, we don't have non-COVID people to any great extent in the hospitals. Hospitals have now turned into effectively ICU hospitals for COVID patients. So we wanted to convert Javits from non-COVID to COVID. It's federally run. Frankly, the federal agencies were not eager to do that. FEMA was not eager to do that. I called the president. I spoke to him about it yesterday morning. Yesterday afternoon, the president called me back, said he spoke to the task force. They would grant the request to transition the Javits Center to COVID only. That adds 2,500 beds. So that is a very big deal. And I thank the president for doing it. He did it despite the fact that the federal agencies were not eager to do it. And he did it quickly. So I thank him for that. It's a big deal for us. We're still challenging, we still have the challenge of ventilators. We don't have enough, period. This situation is very simple now. People come in, they're almost all COVID people. Ironically, the number of non-COVID cases has dropped because so many things are shut down that you don't have the same number of automobile accidents or people getting hit by cars. You don't have the same crime rate. So you don't have the same number of trauma cases coming into a hospital. They are COVID cases, and many of them go right to the ICU. In the ICU, you need a ventilator. And if you don't have a ventilator, the process stops, and we don't have enough ventilators. We're doing everything possible, splitting of ventilators, using BiPAP machines by this new protocol, using the anesthesia ventilators. We're talking to the federal government to be as helpful as they can from the federal stockpile. But in truth, I don't believe the federal stockpile has enough to help all the states, because you can't buy the material at this point. We're still trying to buy from China. We're working with Alibaba, which has been very, very helpful to us. I spoke to Jack Ma and Mike Evans, who is the president, and they have been personally gracious and very, very helpful in trying to get us to source material from China. But we're going to have to redeploy ventilators from across the system. In other words, there are hospitals that have ventilators. There are hospitals that have PPE equipment. There are private sector companies that have PPE equipment that they are not using, that we're going to need to redeploy to the places in the hospitals where we need them. I had a conversation with the hospital administrator yesterday. I understand they don't want to give up their ventilators. Ventilators are expensive pieces of equipment. I understand that even if they're not using them, they are reluctant to see them go out the door. The theory is if the government gets them, they'll never get them back. I understand that, but I don't have an option, and I'm not going to get into a situation where we know we are running out of ventilators, and we could have people dying because there are no ventilators, but there are hospitals in other parts of the state that have ventilators that they're not using. I'm just not going to allow us to go there. I think it would be wholly irresponsible. So I'm going to sign an executive order that says the state can take ventilators and PPE from institutions that don't need them now and redeploy them to other parts of the state and other hospitals that do need them. Those institutions will either get their ventilator back or they will be reimbursed and paid for their ventilator so they can buy a new ventilator. I can't do anything more than that, but I'm not going to be in a position where people are dying and we have several hundred ventilators in our own state somewhere else. I apologize for the hardship to those institutions. Ultimately, there is no hardship. If you don't get the ventilator back, I give you my personal word, I will pay you for the ventilator. But I'm not going to let people die because we didn't redistribute ventilators. The National Guard are going to be deployed to pick up these ventilators, which are all across the state, and deploy them to places where we need them. State budget passed last night, 3 a.m., as you know. The state budget was extraordinary. First, it passed a lot of major policy initiatives that we should all be very proud of. The nation's first domestic terrorism law. It improved bail reform. It addressed this child vaping scourge that is going across this nation. We banned fentanyl, a ban against the repeat subway sex offenders, campaign finance reform, paid sick leave, middle class tax cut, very aggressive airport construction program, and accessible renewable energy siting. I understand we're all consumed with the coronavirus situation, but you have to be able to walk and chew gum. We have to move forward at the same time, and that's why passing the budget and these pieces of legislation were important, because these issues are still important. And child vaping, etc., surrogacy, these are major issues for people, and they passed last night, and congratulations. The budget was difficult because the state is no money. And how do you do a budget when you can't forecast revenues? We came up with some kind of budget that actually is calibrated to future revenues or losses. So we really start with an assumption, and then what we're saying is when we see how much revenue the state makes, how fast the economy comes back, what the expenses are, we'll calibrate accordingly. We are heavily reliant on the federal aid legislation that gets passed. The federal government has passed a couple of pieces of legislation. They're planning to pass another piece of legislation. It's very important that whatever legislation they pass helps state and local governments. When you deprive a state government, all you are actually achieving is that that state government has to turn around and not fund the programs that were dependent on that state government. We fund education, we fund health care. I spoke to Speaker Pelosi today. She's working on the program for the next piece of legislation. She understands fully the need of state governments. She understands fully the need of local governments. She understands my position on how New York was shortchanged in the past bill. And she said she's going to do everything she can do to help New York. I've worked with the Speaker many times. I've known her for 30 years, and I believe her, and her credibility and her competence is unparalleled in my opinion. So I'll be working with the Speaker and the rest of the congressional delegation going forward, but we need federal assistance. Depending on how much federal assistance we get, will be that calibration of the budget going forward. Coronavirus response in general. There's a lot of conversations about how we should respond to this governmentally or from an intergovernmental perspective. People want to say, well, this is a states' rights question versus federal interference. Who should decide what's done on a state level? There is no governor who is arguing that their state's rights are being trampled, right? So it's not a state's rights issue. No one is standing up saying the federal government is trampling my rights. I've said that on other occasions, but no governor, Democrat or Republican, is saying that here. Every state is saying the same thing. I need help. I need assistance. So I don't consider this situation with the federal government as interfering with the state's right. This is a situation that is by definition, a national disaster emergency situation. scores of federal emergencies. The only operational model that I see that could potentially work here at this stage where we are today with the realities we're facing, where no state can get the supplies they need. No state can get the PPE they need. No state can get the ventilators they need. The market has literally collapsed. The only operational model that I see is you have curves. We've been talking about our curve. You have curves in different parts of the country. And those curves occur at different times. It depends on when the outbreak started in that region, how quickly it spread. So you have different curves in different parts of the country occurring at different times. I think the only practical solution at this point is focus on the emergency that is in front of you. Focus on the emergency at the place and time that is in front of you. And then redeploy to the next situation. So, New York is the tip of the spear, so to speak. We have the high numbers. We have the first major encounter. Deploy resources to New York. Well, hit that curve. We'll be at the top of the curve. 17 days, 21 days, we're on the other side of the curve. And we're coming down. And then I don't need the ventilators that we've amassed and split and the BiPAP machines. We can redeploy what we have, personnel, equipment, to whatever locality is next. Now, it's not a perfect sequential timing.